The nurse is monitoring a 32-year-old male client, currently receiving blood transfusion therapy for massive blood loss after a vehicular accident. Upon assessment of the client, the nurse noticed untoward transfusion reactions. Which manifestations should alert the nurse that the client is experiencing a hemolytic transfusion reaction? Select all that apply. A hemolytic transfusion reaction is a serious complication that occurs when the red blood cells that were given during the transfusion are destroyed by the person's immune system. When red blood cells are destroyed, the process is called hemolysis. Symptoms may include back, flank pain, bloody urine, chills, fainting or dizziness, fever, and flushing of the skin.
2. After the nurse assessed and evaluated that the male client is manifesting signs of hemolytic transfusion reaction, she plans to implement what appropriate actions to prevent untoward complications. Select all that apply.
Rationale, course of action during a hemolytic transfusion reaction. Stop transfusion immediately and follow other steps for managing suspected transfusion reactions. Seek urgent medical assistance. Maintain blood pressure and renal output. Induce diuresis with intravenous fluids and diuretics. This may become a medical emergency, so support blood pressure and maintain an open airway. Do not administer additional blood packs until cleared by hematologist or transfusion service provider.
3. As the nurse documents the findings of the male client, she knows that the usual causes of acute hemolytic reactions can either be immune-mediated or non-immune mediated. Immune-mediated reactions may be associated with what factors? Select all that apply. Rationale: immune-mediated reactions may be associated with ABO/RHD mismatch, red cell alloantibodies, non-ABO, as a result of immunization from a previous pregnancy or transfusion, and rare cases when Group O donor platelets with high titers of anti-A or anti-B are transfused to a non-Group O recipient. Transfused red cells are destroyed as a result of incompatibility between antigens on transfused donor red cells and an antibody in the recipient's circulation. Options 3 and 4 are the usual cause for febrile non-hemolytic transfusion reactions, FNHTR.
4. The nurse assigned to a client with an arteriovenous, AV, fistula in the left upper extremity for hemodialysis treatments is being prepared for discharge. When planning discharge instructions for this client with a recently created fistula, which appropriate measures should the nurse include in preventing complications? Select all that apply. Rationale: a fistula, also called an arteriovenous fistula or AV fistula, is made by joining an artery and a vein under the skin in your arm. Following these guidelines will help you avoid infection, blood clots, and other problems with your vascular access. Always wash your hands with soap and warm water before and after touching your access. Check the pulse, also called thrill, in your access every day. Do not let anyone take your blood pressure, start an 4 intravenous line, or draw blood from your access arm. Do not let anyone draw blood from your tunneled central venous catheter. Do not sleep on your access arm. Do not carry more than 10 pounds 4.5 kilograms with your access arm. Do not wear a watch, jewelry, or tight clothes over your access site. If you had a catheter placed so you can have hemodialysis while your AV fistula or graft is healing, you cannot get the catheter wet. An AV fistula can get wet 24 to 48 hours after the procedure. Prop your arm on 1 or 2 pillows and keep your elbow straight and relaxed to let the swelling go away.
5. The client, after a year-long treatment with hemodialysis and frequent hospitalizations, was diagnosed with clinical depression. One of the medications prescribed to the client is tranylcypromine, Parnate. Which of the following food items should the nurse instruct the client to avoid? Select all that apply. Rationale: foods that contain tyramine should be avoided because it increases the risk of a hypertensive crisis. Do not eat foods that are aged or fermented to increase their flavor, such as cheese, especially strong or aged kinds, caviar, sour cream, liver, canned figs, soy sauce, sauerkraut, fava beans, yeasts, and yogurt. Avoid smoked or pickled meat, poultry, or fish, such as sausage, pepperoni, salami, anchovies, or herring. Do not eat dried fruit, such as raisins, bananas, avocados, raspberries, or very ripe fruit. Do not drink alcoholic beverages. This includes Chianti wine, sherry, beer, non-alcohol or low-alcohol beer and wine, and liqueurs. Do not eat or drink too much caffeine. Caffeine can be found in coffee, cola, chocolate, tea, and many other foods and drinks.